Good evening, everyone, and welcome. So tonight we'll be speaking about Chinese medicine and cardiac care. I'd like to introduce to you a coworker, a neighbor, and a friend, Dr. Kimberly Coleman. And just to give you a little bit of background, she is a community health nurse at Suburban Hospital. She works to or has been serving Montgomery County communities with over 20 years of experience in cardiac critical care. She's committed to providing inclusive, trauma-informed, evidence-based, holistic care, both in and outside the hospital. She has a doctorate in traditional Chinese medicine. TCM informs her private practice focused on prevention, mental health, and autoimmune conditions. She's also a member of her local village, volunteering to help seniors age in place. So welcome, Kim. I, for one, am thrilled to have you.
Thanks so much. I'm so glad to be here speaking with you all. Um, so we're going to talk about Chinese medicine and cardiac care. One big difference between Eastern medicine and Western medicine is that the Chinese medicine and Eastern medicine takes a more holistic view at the body. So systems like the cardiac system isn't as isolated. It's impacted and influences lots of other systems. And we see that in Western medicine, but typically you go to a cardiologist to um, get help with your heart and a renal doctor to get help with your kidneys. But here we're going to talk about how all the organs in the body interact and how they influence the heart and how we might support ourselves to have healthier hearts. Just a little more introduction. My background is in nursing. I've been studying Chinese medicine since 2012 and had an opportunity to study in China. This little guy here is receiving some pediatric tuina. You can see he's a happy camper. So some of the things I specialize in are cardiovascular conditions, particularly psycho-emotional and stress-related illness and how that impacts our hearts. In China, I also studied with a specialist in pediatric tuina as well as a scalp acupuncture physician. So a few disclosures, which Brian mentioned, but I'll reinforce here. So the information that we're going to be going over today is just educational and informational. So please don't use this to self-diagnose or treat. Please seek a professional. Although I am a nurse at Suburban Hospital, the content of the presentation doesn't represent Johns Hopkins, Suburban, or any of our affiliates. The objectives that I'd like to cover today, the first main part of the presentation will be a big introduction to traditional Chinese medicine theory, acupuncture specifically, and then some other modalities that are included in Chinese medicine. And then we'll talk some about the emotional component of disease and the mind-body connection, and how that relates to the different organs in the TCM system. I'll share with you some self-care treatments like foods to eat and some acupressure and even some healing sounds that can be beneficial for your cardiac system. And I put question and answers at the end here, but please feel free. I would really love for this to be an interactive time together. So if there's something you're not catching on to or there's questions as we go, please just raise your hand or unmute. And I think Karen will help facilitate those questions so we can make sure that everyone's tracking. So first, a little bit about traditional Chinese medicine. One of the basic concepts in TCM is this idea of qi, or this vital life force. And an imbalance in that qi causes disease and illness. This is what they've discovered or believe. And part of that imbalance in the qi is due to an alteration in these complementary forces in the body called yin and yang. I'm curious if you guys have heard of yin and yang. Yeah, Karen's raising her hand. I can't see everybody's picture. So yin and yang, some examples of yang are the heaven above us, the masculine, the rational thought, things that are hard, things that are light, the sun, and fire. So we're going to talk some about the fire element because the fire element is what corresponds with the cardiac, with the heart in TCM. And then the opposite of those things are the yin, earth, the feminine, emotional softness, heaviness, and water, which is the opposite of fire. So I'm curious if there's some other things that you guys can think of from nature or from science that might exemplify this yang or this fire aspect. One thing that wasn't on the previous list that comes to mind is this concept in the cells. We have protons and electrons, right? There's a positive and a negative, or light and dark. I'm curious what things that come to mind, opposites in nature and science. Any ideas? What could be yang? You can put it in the chat. You could unmute and share. I see there's something in the chat. Any ideas? So we're in the winter season right now. That's considered yin. So the opposite of the winter season is the summer season, and the summer is yang. It corresponds with fire and heat.
So
Any other ideas?
Marjorie tapped on that a little bit, or Margie. She said hot and cold.
Yeah, perfect. So which one would be the yang? The hot part, right? And cold is the yin. Well, that's what we're learning. Maybe if, yeah, hot and cold. So those opposites that we see in nature and in science, they all can be applied to this concept of yin and yang. And just like in nature, it's not always hot and it's not always cold. It's a dynamic process. So that's why we have this Tai Chi symbol that shows this dynamic interplay between the two forces that make up Qi. It's believed to regain this balance from the imbalances that we need to achieve balance between our internal body organs and the external environment. So I think today in our modern Western world, we're a little disconnected from nature, but the Chinese, especially during agricultural society, they were definitely more in touch with nature and the seasons, and they identified these 5 elements of, and I don't say them in this order, but wood, fire, earth, metal, and water. So we're going to talk a little bit about these 5 elements, and keep in mind that fire is the element that is related to the heart. I know we are all heart patients here. So these 5 elements also have dynamic processes between them. There's a generating cycle and also a controlling cycle. So for example, the diagram in the circle that you see on the right-hand side, this is the generating cycle between those elements. And one way that I think about this cycle and how I can remember it is, if we start with wood, we burn wood and we get fire, right? We use wood to burn and we have a fire. And then when the wood burns, then it creates ash, and that ash turns into earth or soil. And then deep underneath the soil, we have minerals and elements that grow, and that would be the metal element. And then the deep springs under the water are what feed the trees, so that water turns into wood. So this is a generating cycle that moves through the elements. And then just like everything in nature, there's checks and balances. So in addition to this generating cycle or this creation cycle between the elements, there's also a controlling cycle or some checks and balances to that generation. So for example, what controls fire? Water controls fire, right? And what does fire control? Fire controls metal because it can melt metal, right? And so just the same, all of these elements have checks and balances on one another. You can imagine that wood controls earth, like you can picture the roots of a tree holding the earth in place so that it doesn't get washed away. Or earth controls water, like the banks of a river help to create a boundary for the water to flow in. So that's some examples of these elements. So specifically for the fire element, it corresponds with the summer season. That's the hottest season of the year. And the emotion, which we're going to talk about more, that's related to the fire element is joy, or actually overjoy. It's things like anxiety or impatience or hastiness. So the 5 elements and emotions, you can see here they're listed on the left, and we'll focus on the fire and the heart element. Some people say hate, and that may be like really strong, fiery. You can imagine strong emotions, but also things like impatience or hastiness or anxiety can be related with the heart and the fire element. And just to give a little overview of each of the main there's five solid organs in the body according to TCM that correspond with each of those elements. But there are 12 meridians in Chinese medicine, and you can see them in the drawing on the right here. So as I mentioned in the write-up for the talk, when we have surgeries and our physical bodies are cut, whether we have open heart surgery and it's our sternum, which goes along a meridian on the outside of the body called the renmai, or the conception vessel, or we have an open heart surgery and they take a vein from our leg. So the physical and energetic meridians are also impacted when our physical bodies are cut. So we can think about how that might affect our emotions as well. So starting with the wood element in that generating cycle, which corresponds with the liver. In Chinese medicine, the emotions that are related to the liver are anger, frustration, irritability. And you can see a picture of the path of the liver here. So for example, I know most patients after open heart surgery, I don't know what everyone's cardiac history is here, but after open heart surgery, there's often chest tubes that are placed on the sides of the ribs here. So that may be along the area of the liver meridian. And then again, the fire element is related to the heart and this sense of like overjoy or excitation, excessive excitement or overstimulation. And you can see the heart channel goes from the inside of the pinky finger all the way up the inner aspect of the arm and ends in the axilla here underneath the arm. And all of these meridians and points are bilateral on the body, meaning they're on both sides. So the right arm is pictured here, but it's on the left arm as well. And the same for the legs. And then the next element is earth, which corresponds with our spleen or our digestion, and the emotion that's associated is worry. So you can think about when you're really worried or anxious, you sort of get this pit in your stomach, also overthinking and pensiveness. And how this might relate to a cardiac patient, you can see the channel that goes along the inside of the leg there. So in cardiac surgery, at least, they often use the saphenous vein in the leg, and they take a portion of that and they use it up in the chest to create a graft. So they may have cut your leg along this area where the spleen meridian travels. And so there might be a physical change to that meridian in your body. The next element is the metal, and that corresponds with our lungs. And the emotion that's correlated with the lungs is grief and sadness. So you can think about when we feel sad, we might slump our shoulders and sort of be in this position so that we're not breathing as deeply. Or maybe if we're crying, then it's hard to breathe. There's lots of gasping. And one thing that I was talking with Karen about for patients that have pacemakers, perhaps where lung 1 and lung 2 are here in the upper chest, just under the clavicle, maybe near where the incision was for their pacemaker. Lots of times patients after open heart surgery struggle with sadness and depression. And that may be how the energetic and physical heart itself was manipulated, but it also, could be impacted by where the cuts on the skin are that are impacting these meridians and channels in the body. And the last of the 5 elements is the water, and that relates to our kidney. And the emotion is fear or fright. So you can think about a little child perhaps that had a nightmare and maybe they wet the bed, or even as adults, if we're in a terrifying situation, we may lose control of our bladder. And so that's one of the links that I use to remember that the kidney and the fear are related, this emotion of fear. So just a little more on how these are all related as far as the wood and the liver element impacting the heart in this generating cycle. The liver in Chinese medicine has a lot to do with our emotions in general, and it's impacted by stress. And this correlates with the wood-fire dynamic in Chinese medicine. But also, if the heart has been weakened, it can also have a reverse impact on our liver, and we can develop emotional imbalances. The next Earth is the other side of that generating cycle. And there's lots of research out there that shows impacts of a poor gut biome, microbiome, impacting things like depression in patients, whether they're cardiac patients or not. So it's very important to maintain our gut health because it impacts our emotional health as well. So weak digestive systems, not only in Western medicine, but also in Chinese medicine, will drain the heart and impact our emotions. So improving our gut health, specifically the gut microbiome, can help to improve our mental and emotional state. So nothing is isolated here. That's the picture I'm trying to paint for you guys.
Hey, Kim, I have a question.
Ah,
It goes back a couple slides, but
mhm.
of course, sorry.
Yeah.
But I think I'm just wondering, I know several of us have had open heart procedures. We've had the chest tubes, we've had the drains, we've had the big incision in our groin where they've had to, sort of attach things to
Mhm.
us. And so when you look at these meridians, should sort of us being lay people, are those neural pathways? Like, are they following sort of the nervous system? And then when they're cut, are you suggesting that some of the transmission, if you will, or the imbalances start at that point, but then hopefully over time those pathways reconnect and service in a better in a more normal way, right? Am I saying
Certainly, that's a
that
great
correctly?
question. Yeah. So the meridians, many of them do follow along nerve pathways, but they're not necessarily, it's not the nerve itself. It's more of an energetic line in the body. When we do some of the acupressure later, you will notice most acupuncture points are in spaces in the body, empty spaces, hollow spaces. So, for example, there's a very popular point here on the hand between the thumb, this sort of webbing, this webbed part. And I would encourage all of you maybe just take your thumb and forefinger and pinch that area. It may feel a little sore or a little achy. Um, and a lot of times, many primary acupuncture points will have this feeling when it's pressed. Um, and so the Chinese in meditation years ago sort of discovered these points on the body. So they do follow nerves in some areas, but they're in sort of empty, hollow spaces in the body between fascia, between bones and muscles. And certainly as the scars heal and as the tissues heal from the cut, then yes, then the body heals and the emotions also could ease. Yeah. Thanks for that question.
Hey Kim, this
Yes.
is Jerry.
Oh,
So,
hi.
so scar tissue, like if you have a muscle that was torn and then you build up scar tissue, it never functions quite as well. Or you have a bone that breaks and you get scar tissue, it's actually stronger than before. So do the meridians kind of have aspects of that too?
Um, I think the scar tissue may impact the scar tissue where things aren't the same as before may impact the meridian in a more negative way, but that all can be loosened with massage and with acupuncture and things like that. Um, I'm not sure how to answer the second part of your question, but I hope that helped.
Sure.
Thanks. Yeah.
I
So I
got
want.
one real quick.
Oh, sure, Brian.
Can the meridian ever become more sensitive?
Our bodies are very dynamic. So different points at different times in different seasons of the year, in different times in your life, it's a very dynamic process. So every time a patient comes in, I feel their pulse and I palpate some of the areas that I want to needle, and it's going to feel different than it felt the week before when they were in my office. So nothing is static in our bodies. When it's static, we're gone, the yin and yang are constantly in a dynamic process, and these elements are always interacting, and the meridians are going to change over time.
Okay, but can something promote it to be more sensitive?
By more, explain what you mean by more sensitive.
When you're saying the lungs and depression and that kind of thing,
Like
doing
more,
acupressure and certain pressure points, can it make the meridian become more sensitive?
I wouldn't say the meridian becomes more sensitive. What I would say is that the acupressure can support your body to become more balanced. And in that place of being more balanced, then the emotions would be eased.
Okay.
Is that helpful?
Yeah.
Okay.
I'm sorry. Yes. Thank you.
Okay, great. Um, So as TCM practitioners, as traditional Chinese medicine practitioners, our diagnosis is in 4 parts. And this is similar to what you would experience in Western medicine. They're gonna, palpate and listen to your heart and ask you some questions, and we do that too. In Chinese, it's called Wang, Wen, Wen, Xie, these 4 parts. The Wang is looking, observation. The Wen is listening and smelling. So in ancient times, before we had a lot of diagnostic tools, the Chinese medicine doctors would notice a lot of things by just listening to the quality of your voice, maybe how heavy your footsteps are, or smelling things, the smell of your breath, the smell of body odor, and all those are pieces of information. Nurses who are very experienced can walk into a room and say, this patient has a particular bacteria because that bacteria has a particular smell, and we're very used to that, correlating those things. The Wen is inquiry or asking questions, and the Qie is palpation. And I'll talk about each of these briefly. So again, using our observation skills, because in Chinese medicine, we don't use as many fancy diagnostics tools as we do in Western medicine today. So paying attention to the posture and the gait. There are 4 body constitutions in Chinese medicine. So you might look at these 4 phrases: Tai Yang, Tai Yin, Xiao Yin, and Xiao Yang, and the shapes that are associated with them. And if you can, we can all sort of decide, well, which shape is my body? Is it more like an upside down triangle? Is it more round, like a pear? Is it pencil shaped and very thin? Or is it more like a rectangle? And that gives us information. Also, facial diagnosis and complexion, particularly with the heart. One of the things in Chinese medicine, in the classics, it says that the heart manifests on the face. So you can see the picture on the right with this red face, and that would tell us there's some excess heat or there's some cardiac condition if we see a red face. And even aspects of the personality give us information that we observe in patients. So you can see some of the normal functions of the heart here. It helps the circulation, the blood circulation. In Chinese medicine, I should say, it controls sweat. It's in charge of joy and happiness. It opens into the tongue and affects our speech. And I can't see the right sides of my slide, so you guys can see the rest. Listening and smelling. So we're going to listen to the patient's footsteps even. They say one of the best doctors can begin to diagnose when the patient comes in the door because they're listening to the quality of their step. And then their voice quality. One thing about the heart in particular and the fire element is this quality of like a laughing. And there might even be a mental imbalance. If it's too much laughing or inappropriate laughing, then we would know there's something maybe wrong with the heart. Also, the sounds of the breathing, and then body and breath odors. So the smell that's associated with fire, you can imagine, is a scorched or a burnt smell. And heat in Chinese medicine often is correlated with a bitter taste in the mouth. So these are some clues that we have about what sort of imbalance is going on in the body. This picture on the right is of the ear, obviously, but sort of superimposed on that is what you could imagine to be like a fetus with a head at the earlobe and the back wrapped around the outside of the ear and the internal organs inside. So we can use auricular acupuncture to treat the different organs in the body. And you'll see there's the lung down at the bottom and up toward the top, the kidney and bladder. So all the major organs are there. And we can treat them by needling those areas of the ear. Also, we look at the ear and see if there's any abnormalities, and if it's in the area of one of these organs, then we may ask some further question about that particular organ if the patient has symptoms. So then we would do some inquiry. So there's
Hey, Kim,
Yes.
This is Jerry again.
Hi, Jerry.
So
Jerry's my
like
friend.
wrestlers that have like cauliflower ear,
Mm.
um,
Oh, you cut out. But I can imagine what you were going to say. And if you come
yes.
back in, you can.
If they have cauliflower ear, does that tell you anything diagnostically about their body?
Well, I probably would ask if they were born that way or if it happened after. And if they're a boxer, then they would, then tell me, oh, this happened after, during my boxing career. Um,
Probably during
Mostly,
a concussion.
yes, certainly. I think what I mostly pay attention to are abnormalities on the ear that the patient was born with or that develop without an actual physical trauma to the ear.
Okay.
Um, Sometimes there's spots that come up, and it might make me ask about some part of their body that area corresponds with. Um, Great question. Thank you. So in the inquiry, we're going to ask the same things that your Western doctor asks about family history and health history and what complaints you have, but we also have these TCM vital signs. So things, pain, appetite, bowels, thirst, sleep quality, and mood. These all give us more information about what imbalance is happening in the body so that we can treat it. And then palpating. So now we're going to talk about a little bit about the pulse, but we do more than palpate the pulse. We also, when we're feeling, are noting the temperature and texture of the skin. We do radial pulse diagnosis, which I'll share a little bit about with you, but also abdominal palpation and channel palpation. So if you're having an issue with your heart, we may palpate the heart channel to see if there's any irregularities there, and then choose to needle at those points. But this is our pulse diagnosis is actually 3 points on both hands. And you can see in the diagram here that the heart pulse is on our left hand in the upper position, that Sun position. So if you want to all practice feeling your heart pulse, you can hold up your left hand and wrap the 3 fingers from your right hand around the back of your wrist. And that pointer finger on the top near the wrist crease, that's the heart pulse. So we have these 3 positions, and there's also 3 levels, a surface level, a mid level, and a deep level, and those give us different information. There's actually 28 qualities or more of the pulse, like fast, slow, wiry, forceful, forceless, weak, strong, lots of things that we're considering in each of those pulses, not just the pulse rate, which is what we look at in Western medicine. So now you all know where to feel your heart pulse. And then we also look at the tongue. So the heart in Chinese medicine on the tongue is manifested at the tip. So patients who come in and the tip of their tongue is very red, I may ask them if they're having anxiety or if they're not sleeping well, because these are some of the things that have to do with a heart imbalance or heat in the heart. But in addition to the different parts of the tongue correlating to organs in our body, we're also looking at the tongue body itself, any coating that's on the tongue, the color, the texture of the tongue itself, and maybe any other pathology that's going on with the tongue. So you all can look in your mirrors before you brush your teeth tonight and take a look at your tongue. If there is a coating that develops there, I want to see that because that gives me lots of information. And then additionally, the TCM diagnosis back for patterns of deficiency or less, things that are less in the body, or a pattern of excess, patterns of heat and cold, or internal conditions versus external conditions. In addition to that, we have something called Zhangfu organ diagnosis. Zhang and Fu, that is Chinese for the solid and the hollow organs in the body. So the heart is considered a solid organ. It's a Zhang. And then channel pathology. So for example, the heart channel that we saw earlier, we might palpate and see if there's any irregularity there.
Hey, Kim, it's Jerry.
And actually, so this excess and deficiency and the yin and the yang we take into consideration. So there is heat and you're experiencing heat, but in menopause, that heat is what's called a deficiency heat. So if we think about, well, I happen to have a blue and a red pen here. So oh, can you see it? I'm blurry.
Just
So
like a
if,
good nurse.
yeah, if yin and yang are balanced, we have balance in the body. If the yang is more, then that would be excess heat. But what if the instead of the yang being more and that's excess heat, what if the yin is too little? Well, we still have a relative heat, right? But it's from a place of deficiency. Does that make sense? So if we have a level line, we can either
Mhm.
have too much yang and that causes excess heat, or we can have too little yin and that the water isn't able to control the fire. So we have night sweats. For women at that stage in their life, in middle age, in their 40s and 50s, the yin is being depleted. And so there's not enough water to balance the yang. And so it's called deficiency heat.
Got it.
Okay. In Chinese medicine, there's also 6 evils, and the one that corresponds with the fire element and therefore the heart organ is heat. So there's interior heat and exterior heat. These are some examples of heat conditions in the body. In the bowels, it would look like loose, foul-smelling stool. In the urine, it would look like scanty, dark urine. That would be heat in the bladder system. Or if you feel averse to heat, like if you tend to run hot, then you may have interior heat condition. Some examples of exterior invasion of heat are things like the common cold, but when you have a fever and sore throat, and exterior heat in the joints is inflammation, redness, warmth, and pain. And we would treat that correspondingly. So heat in the heart would look like anxiety, trouble sleeping, restlessness, things like that. So TCM has lots of different modalities. Acupuncture is one of them. We can just use the ear to treat the whole body, and that is one practice. It's called auricular acupuncture. There's also acupuncture that's restricted to the face, both for cosmetic purposes, but also for patients, for example, who've had a stroke or Bell's palsy. Then we can do facial acupuncture to help to correct the imbalance. Also, scalp acupuncture, which you see in the picture here, is very helpful for many neurological conditions. And then we additionally use electrical stimulation on some needles on the body, particularly for pain conditions. And that sends a gentle current through the needle. So it feels like a gentle tapping or a pulsing sensation, and that just amplifies the effectiveness of the treatment.
Hey, Kim, I'm curious about some of these, after how many treatments could a patient expect to start having some results?
Yeah,
The commitment.
it depends on every patient. If it's an acute condition like a cold, often very quickly you can get good results. If it's a chronic condition, it may take longer to treat. But typically I tell patients, give me 6 to 8 treatments before we shift and move on to a different modality.
And is that once a week, or when you say 6 to 8, is that once a week?
Typically once a week, yes, depending on the condition. Again, if it's acute and severe, it would benefit the patient to be seen more than once a week. In China, when I studied there were clinics that saw patients every day. For example, if you had just had a stroke or you had Bell's palsy, it's a very acute onset, then they want to treat you daily, at least in the beginning, and then decrease the frequency over time as you're having improvement.
I have a question.
Yes.
I was speaking with a group of heart patients last month, and many of us were discussing about how we have PTSD, and sleep deprivation is a huge one. What advice can I tell them when I go back this month?
That's a great question. Yeah, sleep in the hospital, especially after big surgery, is a really big challenge. And hospitals, I think, are beginning to tune into that and have like quiet hours during the night. But is that what you're talking about? The period
No,
immediately
no. Well,
after?
I know that my sleep deprivation is due to the constant waking up while I was in the hospital, but and some of the things that happened in the hospital, but a lot of it is just we can't get over the anxiety and all that stuff, and we can't sleep at night.
Mhm.
And a lot of the patients in the group that I was talking with complained about that.
Yeah. Some of the acupressure points that I'll go over in a little bit may help with sleep, and certainly seeing an acupuncturist. But we're also going to practice a healing sound that's helpful for the heart, and I'll even talk a little bit about doing foot soaks at night, which help to sort of bring the energy down in the body before bed. So those are some things I'll touch on toward the end that could be some suggestions that you could take back to your group.
I have one more question.
Sure.
I did acupuncture therapy for a few years, many years ago. And one of the things that they did for me is they went alongside my meridian in my back. And I felt electric shock pains through my whole body. In
Hmm.
your knowledge, what did that mean? Because I know what they told me, but what did it mean?
Oh, I wasn't there in the room, so I don't want to speak for that specific encounter that you had. But because the meridians do run near nerves, it has happened for me that I imagine that the needle touched the nerve and then it stimulated this sort of traveling effect. Also, actually, in Chinese medicine, we're looking for some response when we needle. The typical sensation is called de qi, which is like a heavy, achy, full feeling where the needle is. But sometimes there is some sort of release or movement that patients experience, often from wherever the needle's inserted to a distal part of the body, meaning further out away from the core, toward their toes or toward their fingers. But it could be that they touched a nerve with the needle too. I mean, that happens.
Hey,
But
Carol,
all over the bodies, yeah, all over the body seems different than what I've experienced with patients.
I was just going to circle back to Carol. I was curious, was it truly pain that you felt, or did you feel just like, a little
It
jolt?
was actually felt like lightning had struck me.
So it was painful.
And it was multiple things. And then I had a very severe reaction where I had lumps the size of your hand going everywhere where a needle was.
Hmm.
It was interesting.
Yeah, thanks for sharing that experience. So the World Health Organization recognizes a long list of diseases, symptoms, and conditions that have been showed in controlled trials to be effectively treated by acupuncture. So I just wanted to highlight the ones that are related to what we're talking about tonight. And primary one is essential hypertension, which a lot of heart patients have as part of their alphabet soup that we sort of get this list of diagnoses. And I'll share a research article with you shortly. And then you can see here, every sort of body system also has a list of conditions that acupuncture has been found helpful for, including neurological disorders, musculoskeletal disorders, respiratory disorders, disorders of the eye, ear, nose, and mouth, GI disorders, gynecological disorders. And what we're talking about this evening a little more is our emotions. So psychological disorders as well, including depression, anxiety, OCD, PTSD, somatization disorder, hypersomnia, and insomnia. And then other things, even like withdrawal from pharmaceutical drugs and appetite suppression. And we talked about the elements and the organs that they correspond to earlier. So you can see, of course, it's going to be, even if you have a heart condition, it's not a solo organ in the body. It really is impacted and impacts every other organ in the body. So we're looking for whole health. This is a study at UC Irvine where a colleague of mine worked as an inpatient acupuncturist there. And they found that electroacupuncture was helpful for high blood pressure. I tend to steer away from talking about herbal medicine. It's not as commonplace here in the US, but that was my specialty during my PhD studies in China. And there are many herbal medicines as well that can be helpful for high blood pressure. And this is an article that I wrote during my years in China that looks at hypertension and so in Chinese medicine, Western medicine diagnoses is one diagnosis, hypertension. But from a TCM perspective, there can be many different TCM organ imbalances that lead to that hypertension. And that's going to affect how we treat the patient. Is it something with their liver? Is it something with their heart? Is it something with their kidneys? And we're going to treat from that perspective. So I was looking at liver qi stagnation, which is related to stress and has a lot to do with our psychosomatic emotions, and then some mechanisms that might link those two things. So what are acupuncture needles? The first ones are made from stone and animal bones, and there were 9 that were described, in the classical text. The needle size and the length vary depending on where we're using them in the body. And they're actually quite small, smaller than a human hair. So you can see this syringe here at the bottom with a large needle that you would, I think this is even larger than we would use to give a shot, but it's just for an example. And then how many acupuncture needles are actually fitting into the bevel of that needle. They're very, very tiny. So how does acupuncture work? This is just one very simplified theory that we use the needles to stimulate the peripheral nervous system, and then that peripheral nervous system stimulates our central nervous system in our brain and in the adrenals and other gland organs in the body, which then release chemicals and impact hormones that are released, and that has a positive impact on our pain response and other biological processes. So a TCM explanation is that we have this qi flow in our body and it's unsmooth. And when it's unsmooth, it causes pain. And the acupuncture helps to smooth that flow of qi, which helps to reduce the pain. So a really simplified summary is that acupuncture helps things to flow more smoothly. And this is just, again, taking a look at where the heart and the pericardium meridians. We haven't seen the pericardium meridian yet because it's not considered one of those 5 primary organs. One of the ways that I remember where the heart organ stops is when you talk about having a pinky swear with someone. And when you pinky swear, the inside of the pinkies touch one another. So that's like our hearts are touching. We're making a promise to one another. And again, that goes right up into the armpit. And the pericardium channel, which we're going to speak more about a specific point called PC6 in a little while, is right in the center here and can help to ease things like anxiety and insomnia and nausea.
Kim, could you say something about back to that last slide?
Uh-huh.
It showed the heart meridians. Does that relate, if you were relating it to acupuncture, does that help dictate where you're going to place needles for that?
Exactly. Yes. So we in acupuncture, we do have things called ashi points, which are not necessarily an identified acupuncture point, but for the most part, we are needling these points specifically on the body. And in school, we learn how to locate those points. In Chinese, they use some measurement called a sun. It's sort of pronounced like Tsun, but in Pinyin it's spelled Cun, sun. So everyone's body's different. So we can't say, okay, heart 4 is 3 inches from the wrist crease, because on you, that might be different than on someone else, even a child, right? So they use this Sun measurement, which is actually like the width of 1, 2, or 3 or 4 fingers of the patient. So when we look at PC6, for example, this is 3 Sun, 2 Sun, which is 3 fingers from the wrist. So if you hold your 3 fingers beginning at the wrist crease, then just below where your pointer finger or your index finger is located on the wrist is PC6. Can you see that? So you lie the whole fingers across the wrist. And if you palpate down, you'll find, oh, my finger sort of falls into this opening or this little dip there. And that's PC6. So yes, we are needling these exact points, and every point has different indications, which
Hey,
we'll talk
Kim.
about. So yeah.
So you know how they have those anti-nausea bracelets or
Yes.
bands? Do those go on that point or
That
roughly
is
on that point?
exactly right. Yes. So here at Suburban, in the perioperative space, we had a nurse that trialed using these anti-nausea bracelets, and that's exactly what they do. They apply a gentle, constant pressure to this point called NAG1 or PC6, pericardium 6, that is in the middle of the wrist there, just up. Just the point that we just found. Another point we're going to talk about later is heart 7, which is right at the wrist crease on the edge as well. And these 2 points combined with a third point on the lung channel make up what is called Buddha's triangle. So it's sort of like to bring peace and calm, we use three points together. Heart 7, PC6, and lung 9, which is on the pointer finger side of the hand. But yes, we're going to talk about 2 points here later so that you guys can learn how to find them and do acupressure. Great questions. So if you're still terrified of needles, we have ear seeds. So these are seeds made from different metals or even a natural seed like a vicarious seed that we can place on the ear. And those different points that correlate to different things. The point that they're using the ear seed on here in these photos is called Shenmen. It's a very relaxing point. It's excellent for treating insomnia or anxiety. So you can even press that point yourself and massage it a little bit. If you feel on the upper part of your ear, there's sort of a little U-shaped indention. And then just at the edge of that ridge, if you press. So when we apply these seeds, the seed is quite small, and then there's a little adhesive over it. So it's pressing on a very precise point. And when you leave that in place, it stays on for 3 to 5 days, sometimes a week. It depends on how much you wash your hair and shower. And then it's always pressing that point, but then you can also increase by massaging on top of the seed as well. And this can bring some relief for maybe kids who we don't want to needle, or to extend the effectiveness of a treatment, we might put ear seeds on your ear after an acupuncture treatment to just help give you something to do also to support your body. And we talked a little bit about herbal medicine. There's over 400 single herbs in Chinese medicine, and then those are combined in different ways to make over 200 formulas. And they come in different ways. These herbs in the picture we call bulk herbs. They're like the whole raw herb that you would boil and make a tea and then drink the tea. It also comes in pre-made granules and things called tea pills, which are sort of more similar to pills that we might take pharmaceuticals, but they're very tiny, like little BBs. So you have to take lots of them to get the dose. It's sort of like, so they've already made the tea and they've concentrated into these tiny little BB balls. And then you take, 8 or 12 of them at a time. Some other modalities in Chinese medicine are moxibustion, cupping, gua sha, tuina, and something you guys might be familiar with, Tai Chi or Qigong. I'm curious, how many of you have tried Tai Chi or Qigong at a community center or a local senior center? It can be very helpful to calm. I see Karen's hand raised. I can only see 5 faces at once. So, Lynn's got her hand up too. Yeah, Lynn teaches Tai Chi and Qigong. Yeah, so that's one thing that can be really beneficial, and I encourage you to seek out a class in your neighborhood. I live in Friendship Heights, and there's a teacher here at our community center. There's also a Taekwondo studio that has daytime Tai Chi classes nearby, and Suburban also offers it from time to time as part of the WellWorks program. So moxa is the burning of herbal leaves on or near the body. And that just helps the heat to penetrate into the body. So if a patient has any cold condition or cold in some part of their body, we may use moxa to bring heat and warmth to the system. Cupping, which you may be more familiar with. There's a famous swimmers and many athletes now are getting cupping as part of their recovery after games. Cupping has many uses, but we use warm glass jars to create a suction. So there's lots of different methods, but I use fire cupping. So you put some fire on a stick into the glass cup and then remove it quickly and put it on the body. So it creates a vacuum and sucks the skin up to create a suction. Gua sha is another therapy that's used, which is using a smooth implement. Traditionally, it was a stone called bianshi to scrape the skin. And you can see the top row of pictures here. There's a lot of purple there. That's called sha. And we actually want to see that response. We might use something like this if a patient has a cold and a lot of upper respiratory system symptoms. But you can see after 24 hours and then 48 hours, it's almost gone. So that purple marking doesn't stay very long, but it can have a great benefit to help to release cold symptoms from the body or for pain or tension as well. And then tui na is like a Chinese medical massage. It literally means push and grab, tui na. Tui is push and na is grab. And these are some photos of some training that I did in China. It's not often offered here in the US. It's quite labor intensive and not reimbursed as far as I know on insurance. But it is a great modality that's used widely in China. And then Tai Chi and Qigong, which is movement and concentration exercises. Again, I would prescribe this for most patients that I have. Lynn, I see your hand up still. I wonder if that's because you have a question or you were raising your hand for the Tai Chi answer. Maybe just the Tai Chi. Okay. So yeah, I would encourage all of you to seek out an opportunity to at least try a Tai Chi or Qigong class. It can be really, really beneficial as a gentle movement exercise to also have a more mind-body connection. So a little more about fire chi. We've sort of gone over this some already, but it correlates with the summer season and the temperature is the heat. The organs are the heart and small intestine. So we haven't talked much about the small intestine, but that's the hollow organ that's paired with the heart under the fire element. And then, so foods that are red in color also support our heart and small intestine. So things in Western medicine, which we've discovered, right? Like pomegranates, we know are heart healthy foods. And the Chinese would have also said this, like red colored foods are helpful for the heart. So other things that we also know are helpful for the heart, like a moderate amount of red wine. They say the resveratrol in the wine is helpful for the heart. Avoiding salty flavors. Why? Because the salt, we know in Western medicine, right? They say have a low salt diet, heart healthy diet. From a Chinese medicine perspective, the salty flavor correlates to the water element, like the ocean, right? Has salty. So from their perspective, if you have too much salt, the water's going to overpower the fire, right? So that was how they looked at how to avoid different flavors, because there's a flavor that corresponds with each of the elements as well. And then the emotion is this overjoy or impatience. So the ancient Chinese believed that we are microcosms in this larger macrocosm, and to find balance between health and disease, we need to restore the balance that is through a very specific treatment with the patient. So in Western medicine, there's often protocols that are applied to broad groups of people. And one, for example, if you have hypertension, then you go to your doctor's office, they're often going to, then maybe there's like 5 different classes of antihypertension meds, right? There's beta blockers and ACEs and ARBs and diuretics, and they're going to prescribe one of those to you. And then when that isn't doing its trick, they're going to prescribe a second one and a third one. from a TCM perspective, we're going to consider not only maybe your gender, also your age. Where are you in life right now? What season of the year is it? And what other imbalances do we notice in your body based on our diagnostic procedures? And then the treatment's going to be very specific to you. So if I have 5 patients that come in that want help with their hypertension, I might be treating them in 5 different ways. Oh, I forgot to edit this summer, but so what are some foods, more about foods that I would recommend for someone that had maybe a heat condition, or some overactive fire in their body? Well, it depends on their particular constitution and the pattern of disharmony. So we first want to identify, is it an internal or external condition, excess or deficiency, heat or cold? Again, all these things are considered. But one thing that a lot of people know about and can appreciate is the importance of inflammation and the damage that it can cause. So inflammation is helpful in our body to fight infection and to heal injuries. We need the inflammatory response. The trouble is when it goes out of control, then it causes damage. So anti-inflammatory diets play inflammation plays a key role in inflammatory conditions and things like autoimmune disease, which I've listed a bunch of things here, which inflammation is going to make worse. So choosing a diet that is anti-inflammatory is going to help your heart and help any heat conditions or fire conditions in the body. Some examples are here: seafood, whole grains, fruits and nuts, vegetables, spices and herbs. And these are all part of what we would consider a heart healthy diet as well, right? From a Western medicine perspective. Things to avoid, of course, red meat, processed foods, carbohydrates, and simple sugars. And then I wanted to share these 3 spices with you. So all 3 of these spices are actually Chinese medicine herbs that we use in formulas when we're treating patients. But the one I want to point out or highlight is cinnamon, because it specifically treats the heart in Chinese medicine. So cinnamon is a great warming herb. It's great in the winter time, and it's has a calming effect on the heart. So when you have your whole grain steel oats in the morning, put some cinnamon on them. Ginger and turmeric are also very powerful anti-inflammatories spices, so incorporate them more. There's a very simple tea in Chinese herbal medicine that is helpful for high blood pressure, and it's also quite gentle. It's called Longjing Juhua Cha. The Longjing is dragonwell tea. It's a type of green tea. Juhua is chrysanthemum, which you can buy like the whole flowers of chrysanthemum. And it also includes hawthorn fruit, which is called shanja. This you have to find at like an Asian store. It comes dried. It's quite sour. This helps with cholesterol. And then the dried peel of a tangerine. It's called chenpi in Chinese. And so combining these things together and drinking it daily can help to lower your blood pressure and cholesterol. Another thing that would be great for the heart is rose tea. We use rose. It's called meigui or meigui hua in Chinese. Use it also in formulas. It's very good for the complexion, and it also helps to clear the heart and mind. So someone asked earlier about trouble with PTSD and insomnia. So having some rose petal tea in the evening could be very soothing and calming for the body. And then herbal foot baths. So soaking our feet in warm water in the evening helps to draw the energy from the head and the chest down to the feet. And it can be a very relaxing ritual, perhaps, that you could just try before bed, especially if you're having trouble sleeping. Not super hot water. We don't want you to scald your feet, especially if you have any peripheral neuropathy. But you could put things in there. You could put rose petals in there, or you could put some other herbs, or even just Epsom salts or something like that. And you might find that that helps with your sleep as well.
I have a question.
Yeah.
You're talking about the rose tea.
Resveratrol?
Well, I'm sorry, say that again.
Resveratrol in red wine?
No, rose tea.
Oh, rose tea,
Talking
yes.
about rose tea to calm the heart, mind, and clear the complexion. What if you have an allergy to flowers and things like that.
Oh, well, then I would avoid
Rose,
it for sure.
avoid it.
Yeah, if I mean like a seasonal allergy where like pollen or to specific flowers.
I can't use rose scented anything.
Okay, so I would definitely avoid that. Yeah, if that's an allergy, then this recommendation wouldn't apply for you.
Would you have any recommendations for what to put in the foot bath other than the Epsom salt and rose petals?
You could try the chrysanthemum. How do you do with chrysanthemum flowers?
As far as I know, I'm fine.
Yeah, so you may want to test that out to see, maybe on a smaller area of your body or with a sip of tea or something to make sure you're not going to have any trouble with that. Um, but I would say the chrysanthemum also may be a great thing to put in the foot bath. Is that helpful?
Yes, sorry, I had it muted.
Okay. Okay, great. I just want to make sure I answered your question. So two acupressure points that we touched on earlier, that I just want to highlight again. Heart 7 is called Shenmen, and it's here on the wrist. You can see the picture there. And this helps with all of these conditions. So palpitations, insomnia, panic attacks, manic behavior, and poor memory. And that's on the outer aspect of the wrist, just inside that, the two tendons there. You'll feel sort of two tendons. It's just in between. If you press on it with the tip of your finger, you may feel like a little sore, achy feeling. That's probably tells you you're in the right spot. Any questions about that? Can everyone find that point? Yeah. And then the other point, which Jerry mentioned, that is often used for nausea in the post-op setting is pericardium 6 or Naguan. And this can also help to calm a restless heart. And you can see all the things on the picture here, even with, of course, if you're having chest pain, call 911, take your nitro and get to treatment. But you can also press on Naguan at the same time. Excellent for nausea. I was on a plane once and there was a patient that was very, very nauseous and got up and then ended up twisting her ankle on the way to the bathroom. She was going to be sick. And I ended up, they called for a doctor or a nurse or something. I ended up sitting by her. And for the rest of the flight, I just massaged this point on her wrist and it made a big difference for her. That feeling of nausea or restlessness.
Hey,
Yes.
It's Jerry again.
Mhm.
So, like, you said it could calm the heart. Would that work for AFib at some point?
I don't know if it's going to correct AFib, but certainly, for example, heart 7 helps with palpitations. So the sensation of the heart racing in the chest. Yes. I don't know that it's going to make AFib go to sinus rhythm.
I didn't mean convert it, just make it slow down, like better than, hey, cough, cough.
Right. Well, the vagal maneuver is another option. Right. They're all options to try. Yeah, we can't necessarily count on them, but they certainly can help to bring balance in the body. And needles are going to provide more stimulation than acupressure, but we all have our fingers all the time, so we can always use acupressure until we can find further treatment. Good question. So the last thing that I want to do with you guys before we have some more just informal questions about anything that I've covered is these healing sounds. So you see a picture on the right of the positioning. So I'll just invite you to come to the front edge of your seat if you'd like to practice this together. We're going to interlace our fingers and point our palms up to the sky. And we're going to look up. And the healing sound for the heart or the fire element is ha, ha, like you're breathing out, like a heavy. So if we can just try that 3 or 4 times together, and I'll walk you through it. So fingers interlaced, palms up with arms overhead and the mouth wide open. And this time you may envision the color red being purged. And this time you may think about clearing the emotions of hastiness, impatience, and hatred. Great. And then just taking a couple breaths in. These healing sounds are really meant to be a purging. So after we've purged the body, we want to take a moment to cultivate more positive virtues that are associated with the heart and the fire element. So taking a few breaths in and inviting in compassion, joy, and love. We'll just take 3 deep breaths in. Great. I know we can all use a little more compassion, joy, and love in the world. So we can use these healing sounds again to purge any excess or imbalances in the system, and then take a few slow, deep breaths in to cultivate those positive virtues of the fire element and the heart. So I just want to ask, after that exercise, for those of you who tried it out, how do you feel differently now? Just after those few breaths, any feedback? How are you feeling different in your tissues? What are you noticing? Or maybe you can practice before you go to sleep tonight. But you'll see there's a healing sound for each of the organs and for each of the elements. They all have a slightly different sound and also a different body position. So we covered the one for the heart. And that may be another exercise that could be done perhaps while your feet are in the foot bath. That doesn't need to be for very long, 15 or 20 minutes, and you could practice a few of these ha breaths to clear any excess from the heart. And then a few slow, deep breaths, inviting those positive virtues. These are a couple of references that I used in my presentation. And now there's some time for questions. This is my contact information if anyone needs it, and I'm sure that can be shared afterwards as well.
Kim, I have a couple of questions if I could pop in. So one of the things, and you know, everybody knows I'm a heart patient, and curious to know, you know, so many of us after our heart procedures, like you mentioned, we're on beta blockers, statins, blood thinners. How do those medications, do they sort of mess up our meridians? Does it make what you do more difficult? I'm not suggesting we should go off these medications, but just wondering how that works in terms of what you do.
Sure. I mean, since I also have a background in nursing, but most acupuncturists, we also take Western medicine classes during our graduate studies. So we're aware of the pharmacology that you're on, and we take that into consideration. So as you guys know, beta blockers, for example, cause exercise intolerance. Like the heart isn't able to get up like it normally would because you're on the beta blocker. So it's just more information. It doesn't impact the meridians necessarily, but it's information that we need to consider in our treatment. Like when we feel your pulse, if we know that you're on a beta blocker and we notice that the pulse is slow, we have a reason for that. It's not necessarily because there's been like a cold invasion of the body, for example, which would be another reason why there would be a slow pulse.
Mm-hmm. And also kind of along those lines, and this goes back sort of more towards the beginning of your presentation. You know, a lot of us, I think, feel, you know, a lot of us are repaired, right? I have a graft, I have wires in my sternum, I have leads going into chambers of my heart, I have a hunk of metal here. Some of us have had knee replacements, shoulder repair. I'm just wondering how all these sort of unnatural devices that are in our bodies now for the rest of our lives, how does that mess with our meridians and again, sort of what you do?
Certainly.
Like, are we still candidates? Can we still benefit from
Of course.
therapy?
Yeah. So for example, one contraindication for electrical stimulation is a patient with a pacemaker. We would never use e-stim on a patient with a pacemaker. So though that is part of the history that we take when you come in. And so E-stim isn't available to someone with a pacemaker, but again, Chinese medicine has a lot of other modalities that we can use. So it's just more information. If you've had incisions near channels, it's information. We can also needle around the scar to help loosen the scar tissue, and ease the flow of energy through that area.
I have a question.
Yes.
Is there any way to get copies of your slides? Because there are about 2 of them that I would like to share with the group that I'm going to be meeting with next month. Would you
Sure,
allow me
I'm
to share?
happy. I don't mind. Yeah, I generally make it into a PDF so that it's not
Yeah.
editable. And
If
I'm
you
also
give if
happy.
you give it to Karen as a or to me, I can certainly make the PDFs and we can distribute it, or you can make the PDF from PowerPoint.
Yeah, I'm happy to share the PDF. And if there are specific slides and you just want a PDF of that slide, I'm happy to do that too.
Well, the one slide that I'm very, very interested in was the foot bath
Okay.
for insomnia and all, because a lot of the people I talk with, that's a major, and the PTSD, but those 2
Right.
slides together. And
Yeah, and I would say
those 2 would
the
help.
yeah, the acupressure as well may also be helpful. And
And
this Shenmen on the ear,
Yeah.
acupressure here.
Yeah.
and Dr. Coleman, just following up, and by the way, what a remarkable presentation. That was absolutely wonderful.
Oh, thank you
That-
so much. It's hard to gauge, like, is it sinking in? Is it too much? Is it too little? I appreciate that feedback.
Well, it's also been very relaxing. We didn't participate in those last 2 exercises, but speaking for the yin and the yang here, we haven't been this relaxed in a long time.
Oh, I'm so
Thank you for
glad.
that. The question, what caught our attention, so many of us deal with high blood pressure, for example, and excellent, very interesting options there. And our question isn't so much about us per se, but a lot of us are on high blood pressure meds, and then there's outstanding TCM options as well. What's the process by which that you and your colleagues work with patients, work together to make a decision about which way to go or what combination to go in making those choices? High blood pressure being an example, I could ask the same question about almost anything that you just talked about. What's the decision process?
Yeah,
Please.
great question. So most patients come to me independent of their primary care physician, but I often reach out to their primary care physician to let them know, hey, by the way, your patient came to me, and this is the treatment plan that we've developed, and make sure that they don't have, that if they have any questions for me, certainly I can help to answer them. The wonderful thing about Chinese medicine is that some people describe it as a complementary medicine. I don't like to use the word alternative because I think there's a place for both East and Western medicine, and it can be used in conjunction with the medications that you're taking, taking into account all of the conditions. But for example, hypertension, acupuncture can help with that in addition to the blood pressure medication you're on. So I can be in communication with your doctor, and I would encourage you, for example, as part of my nursing work at Suburban is running a blood pressure screening clinic at the local community center. So I would want you checking your blood pressure regularly. And if we see that it's trending down, then we can have a conversation with your physician about reducing the dose of your medication.
Thank you.
Yeah, great question. Thank you. And that's one thing I guess that, I feel like distinguishes me from some other acupuncturists, because I do have a lot of experience as a nurse with Western medicine, particularly cardiac care. And so I really enjoy engaging physicians and cardiologists in, working together to improve outcomes.
Well, we may get the opportunity to engage because Friendship Heights, we live just a stone's throw from there. So,
oh, wonderful. Well,
Tuesdays
from 12 to 4, every Tuesday, there is a nurse, either myself or a volunteer nurse, that is there to check your blood pressure. And they also provide nurse consultations. So if you have questions about your medication or any other health condition, we're happy to speak to that or refer out. Yeah. 12 to 4 on Tuesdays at the Village Center.
Can I want to ask a leading question that probably many of us older people think about. Now, only talking about original Medicare. Can you make a comment about Medicare and such treatment, and does it cover it?
That's a great question. And I'm sure it's at the top of mind for everyone. Like, will my insurance cover this? Medicare right now does cover acupuncture. Unfortunately, it's only for one diagnosis, chronic low back pain. But if you also have chronic low back pain, you could be treated from an acupuncturist, and they also can treat other things. I will say, in addition to Medicare, if you have a supplemental plan, my encouragement is to contact your supplemental plan. There's a few questions. Ask if they cover acupuncture. Ask for what diagnoses they cover. Like, some only cover for specific diagnoses and some are more broad. How many treatments per year are you able to have? And what's the, if you're going to someone who's out of network, what's sort of the reimbursement rate or the percentage that you can expect to get back from them as for reimbursement if you submit on your own? Many insurance plans do cover acupuncture, Blue Cross, Aetna, others at different rates for different conditions.
What's a good way of finding a practitioner? It's been decades since I've been to a practitioner.
Great question.
I've had 4 different practitioners during that when I was doing it, and one of them was really bad and one of them was really good.
Yeah, I think asking for referrals is a great way to start, but if you don't know anyone else in your community that has had acupuncture or is happy with their acupuncturist, then another resource is our national certifying body, NCCAOM. I won't tell you what that stands for, but if you go to nccaom.org, I believe, they have a Find a Practitioner button, and you can search based on your zip code for those in your area. And then the next step would be to contact a few of them that are near you and see if they're covered on your insurance, and then try them out. Also, I've gotten referrals. I've had patients come to me through listservs. For example, like Cleveland Park has a listserv, or and then they'll ask on the listserv, "Oh, who do you recommend?" And someone there will mention me, and then I get a patient that way. So looking for recommendations from others who've had personal experience with the acupuncturist is a good place to start. But if they're also certified by the national certifying body in addition to the state licensure, then that's good news as well. They've taken an extra step in their certification.
And Kim, do you see patients out of your home, or are you out of a clinic somewhere?
I have an office here in Friendship Heights. I sublet space 1 day a week, and I see patients there. Mm-hmm.
I got one.
Mm-hmm.
Might be a little off. Does acupuncture, could it help, like maybe with the onset of a person with maybe dementia or Alzheimer's or that kind of stuff? Does it?
That's a good question.
Receive any benefit from it?
The incidence of those conditions is certainly increasing, and what they're finding is that is, part of a metabolic disorders and has a lot to do with inflammation and our metabolic processes. It's more closely linked with things like diabetes, and all of those processes, including cardiac conditions, are impacted by inflammation. So that's a long answer. I mean, certainly yes, I think it can help to some extent. I would use some scalp acupuncture and also treating from a metabolic perspective to reduce inflammation in the body and the brain.
Now, how much of a factor does age play in it? Would it be more helpful possibly for a person in maybe in their 40s or 50s versus a person in their 80s or 90s?
I think acupuncture can be helpful for anyone at any age. I have a patient now in their 90s who has found benefit. But certainly as we age, it's harder and harder to recover from illnesses, right? I mean, we all come into the world and we all leave the world. But assisting patients and improving their quality of life while they're here is certainly something that I'm passionate about.
Okay, thank you.
Also, if any of you have specific, or if you're looking for an acupuncturist and I'm not in your area and you want to let me know, you feel free to send me an email or a message through my website. And I have lots of colleagues all over town, and I'm happy to connect you with one of them.
Would you mind sharing your email again, please?
Oh, sure. It's Kim at tcmdrkim.com.
M or N?
KIM is in Mary.
Yeah, no,
And then
TC.
TCM, Traditional Chinese Medicine.
Okay.
TCM is in Mary, drkim.com.
Well, I think if that's it, we should wrap this up. Thank you so much, Kim. Thank you, everyone that was able to attend tonight, especially the new faces. Please join us in the new year, and happy holidays to everyone.